Hello and welcome back, and today's case is that of correction blepharoplasty, and this lady, she had underwent a fat grafting procedure for her upper lid surgery and she was somehow not happy with it. Somebody did her upper lid fat grafting and which was very uneven, and she wanted to get rid of this extra amount of fat which was there on her upper lids. So she came to us for the removal and also to remove the extra amount of skin that she had, and we did for her the upper lid blepharoplasty, in which we removed the extra amount of skin in the upper lid, we removed all the extra amount of fat that was grafted over there, as well as we gave her a very nice contour to make her eyes more open. I am Dr. Ankit Gupta. I am a plastic surgeon. I regularly do blepharoplasty surgeries at my center, and this lady came to us with this issue. And what we did for her was under local anesthesia. It was about 1 hour's job. It took me half an hour to operate on each side of her eye. We gave a cut, we opened the skin, and whatever the extra amount of fat was there was removed very meticulously. We removed all the extra fat so as to give her a very nice contour. We also tightened her lid, and we also removed the extra amount of skin that she had. And after this procedure, usually it takes about 1 week's time for the swelling to subside. The stitches that we give have to be removed at about 7 days. You can get them removed over here or you can get them removed in your city. It's not a big deal. They're very fine sutures which any doctor can remove. Once it is done, the crease which is formed usually takes about 1 month to reach to its final position. For some patients, if it is an Asian blepharoplasty, it can take a bit longer, but usually for simple blepharoplasty cases, it takes about 1 month for the swelling to subside. All you need to take care is you use ice in the initial 2 days and then regular massages of the scar after stitch removal. This initially that line is visible, but over a period of 3 to 4 months, the cut line or the scar that is given gradually disappears, and in about 1 year it is hardly imperceptible. So friends, if you are looking for upper lid or lower lid blepharoplasties or any kind of periorbital rejuvenation, be it lower lid blepharoplasty, fat grafting, transconjunctival blepharoplasty or lasers, you can always get in touch with our patient coordinators and they will be happy to help you. Thank you and have a nice day.